Welcome everyone to our endPJparalysis launch of our app for the UK. It's a very exciting evening for us. Interactive with you registering any questions that you have for us. I'll talk you through our panel, introduce you to the panel in the next few minutes, but our agenda will be that we're going to walk you through the app, and that will take about 10 minutes. We'll talk about 100-day challenges and managing your program or your piece of work for launching your endPJparalysis initiative on your wards or in your hospital or care home. And I'll give you an overview of work that I've done. And then we've got a fabulous personal story from Lisa Sharp on how she managed her 100-day challenge. And then we'll give you time for question and answers. So let's get into the gist of the event, and we'll introduce you to the panel. And if we could start with Lisa, then Oriane, then Natalia, and then Natalia, that will link you into the app. So Lisa.
Hi everybody, my name is Lisa Sharp. I am currently a clinical manager and I'll be talking to you about my personal story and how we led an initiative in my local trust.
Thank you. Oriane?
Hi, I'm Oriane. I'm Managing Director at Cambridge Digital Health. We created the app and we're very, very excited to be part of this story.
Thank you. And last but not least, Natalia.
Hi. I'm also with Cambridge Digital Health and I'm a project manager there, and I worked on developing the app.
Great. So Natalia, it would be really good if you could show us how the app works, how we can access it, and off you go.
Sure. Okay. So if you would just bear with me while I share my screen and get all of that right. So what have we got here? Share. Okay. So just to begin with, I'll quickly run through the app. It's fairly straightforward, but there are a couple of things that are worth knowing. Just to let you know, there is a training video, and at the end of this I'll put up a slide to let you know what the address is to access that. And if you do have any questions about the app, just if you could drop them in the chat, and then we'll, as Kira said, just go through them at the end after everyone's had their turn. So what you're looking at now is the login. If you are accessing the app from a mobile phone, do download it from the App Store. It's not ideal to be using the web app on a mobile phone. For the best web experience, access the app on a PC. If we go to registration, what I'm going to do, rather than make you sit through me registering everything, I'll just jump forward here. So once you hit register on the home screen, this is what you'll see. And I've just pre-filled out these fields here. So this is where you select whether you're with a hospital or a care home. So the registration process is slightly different. If you're with a hospital, if you register with an email address that ends in nhs.net, doctors.org.uk and nhs.co.uk, you'll automatically get a validation email into your inbox. So that means you can validate your own registration, you'll be ready to go with the app. If you wanted to register with a personal email address, you can do that, but that will require a validation from your hospital admin, and I'll go a little bit into that a bit later. That's just to give you a heads up on that. So once you click next, you'll go through just some standard screens asking you for country, county, etc. So what I'm going to do is just skip forward here to the section that talks about wards. So the way that the app works is that you are entering data on behalf of your ward. And so if you are a person who regularly is going to be entering the data, then you need to attach an award to your account. You can choose not to attach a award here. So for example, if you are in an operational role and you don't necessarily have a particular award that you want to attach, then that's fine. But what they will do is restrict your sort of viewing access to the data. And you can open that back up again by becoming an admin for your organization. So what the app does essentially is if you're not attaching yourself to a ward to post data for a ward, then it assumes you're in more of a sort of operational role and that you don't need to be attached to a ward, but you have some kind of need to view data or work with the data. So if you click yes there, and then you would go through the process and you would submit your registration. So what that would do is enable you to have access to the app, and it will open up on this Submit Data tab. So I've created a demo account here. We've got your demo hospital. It's got a generic name for a ward. So this is where you enter your daily data. So really simple, just entering your number of occupied beds so it can work out the percentage of how many patients were dressed and mobilized. If you're putting in, say, you have 23 here, you've got 3 here. I'll just do a really quick example. Sorry, my screen is obscured. So we do one of those and one of those, and then we hit submit. Okay. So that's submitting data, really, really easy. What you might find is that perhaps you missed a day where you didn't manage to enter the data. In that case, you just go to edit data. Very, very similar. The only difference is you pick the date in which you missed, and then you pop in the information there. So moving on now to the data tab. So once you've entered your data, obviously you want to have a look at it. So let's go to our latest data tab. Sorry, everyone in my house is on Netflix and using the internet. So, here we go. So you can see you've got this nice little total here of your whole organization and how many patients or residents were dressed and mobile. And then you can start to have a look at narrowing down what you want to view. So if we want to have a look at your ward and you want to have a look at, see, we've got dressed and mobilized patients here. You can have a look at the past month. So what we're looking at here is the whole hospital versus your ward. And there's lots of different things that you can view. You can just look at dressed patients, so you can look at all of these together. It's just really what you're interested in seeing. So down the bottom, we've got some options for downloading. So you can download this graph here. You can also download that in PDF form. So you can download this chart as well. Now there's more that you can download if you're an admin, but I'll just touch on that a bit later. So just checking on my list that we've got. Okay. So you can also, as well as viewing your own organizational data, you can compare data. So if you want to see, for example, how your ward is doing compared to other wards in your hospital, or your county average or your hospital average, you can do that. Again, it's just playing around with these parameters to get the information that you want, and that works in a very similar way to the other tab. So going back to this, just checking I've covered everything there. Yep. So you'll see up here you've got this little active patient award, and this is a really nice thing to reward you for sort of consistent posting and getting those numbers and averages. It's just a nice, really nice motivational thing. And you can see here it says maintain your average for another 29 days. So to get a bronze award, you need to maintain an average of 60% dressed and mobile for 30 days to get that bronze award. And then you can get a silver if you do 60 days, and then it's 90 days for the gold. So not only is that something that's really nice that you can see your progress on when you log in here, but once you achieve those awards, we can email out a nice certificate that you can put up and display, and everyone feels really nice about the hard work that they've been doing. So that's that one there. Okay, so moving on to other little bits. So that's really the main stuff. In terms of adding other awards and specialties to your profile. So if you work over 2 awards, you can do that here in the My Profile section. So that's really easy. You can just add these here. And then the last thing really to cover is admin rights. So I'm going to log into an account that has an admin account. So you can see here, I've got an admin tab that wasn't visible before. And you recall that when I said that if you register with an email address that is not NHS, or those other ones that I said were pre-approved, you'll need to request validation from your hospital admin, and that's where this will show up. So a hospital administrator will be able to approve those there. If your hospital doesn't have an admin, you can either email us to request admin access, or if you haven't got a award attached to your account, the app will prompt you to apply for that anyway. So I think that's pretty much it. This is the link you use to access the web app. But as I say, you can search for the mobile versions on the Android and Apple stores. And this is our website where you can access the training video, which will take you through in more detail, which that I just took you through. Okay, that's it from me. Handing back to Kira to start with the 100-day challenge.
Great, thank you. That was really, really good. And just a reminder to those who may not know that I will talk about the app near the end of my outline of 100-day challenges, because it was a real bonus to have an app from all the work that we had done. Why 100-day challenges? Well, they work and they give you focus to do a piece of really focused work. I started doing them as I had read a book called 100-Day Challenges, and it used the book showed lots of research where 100-day challenges work very well within organisations, because they provide focus and you can pretty much plan a really rapid improvement project within the 100 days. So my first 100-day challenge that I tested out was at Addenbrooke's, Cambridge University Hospital, and it was around trying to get the organisation trained in red to green. So which is a well-known NHS tool where each day you identify a constraint within a patient's journey, and red is that there's a constraint, something may need to be fixed to move the patient on in their journey, such as their TTOs or a piece of equipment. And then as you get those issues resolved, they turn to green. And we had some of the team from eSyst in to support us. So alongside me, we ran lots of red to green training, and we had large groups of people in seminar rooms trained, so that by the end of the 100 days, we had a good group of people trained, consultants, allied health professionals, and it was really, really successful. And we used lots of communications. We picked up things like top tips from pharmacy, as we found constraints with red to green. As people identified constraints on red to green through their training, they said, oh, pharmacy is an issue. Common mistakes that people would make within pharmacy. We had top tips from pharmacy, top tips from physio, so it worked really well. And then moved to King's Lynn, where they had done an awful lot of work, in particular AJ Weir, who's absolutely a fantastic change agent, and she had done a lot of work on the red bag. So that was around for a load of people coming into hospital and having a red bag with their some clothing and their tablets and information about them that was important. And hopefully we'll get AJ to talk about that fantastic initiative on another webinar. However, again, red to green training was an issue. So not to be held back, as a newbie in the organisation, with the help of AJ, we launched red to green. And we did lots of certificates for people as they progressed through their training for red to green. And we brought in elements again, like top tips. And AJ was really the main trainer, and she trained over 2,000 people in an organisation that has about 4,500 staff. So that was pretty phenomenal. And that's where then Lisa Sharp comes in, because I met with Lisa. We held an event at King's Lynn with the fantastic Brian Dolan, who talked about the last 1,000 days, and he talked about why it was really important to get patients up, dressed and moving out of their beds and home, or not in a hospital for the last 1,000 days. So that really rang with us and touched us all in terms of getting the last 1,000 days for patient, making them the best they could be, and home. And we all went, so it was almost like a rule of 8. If you groups are with 8 people, and everyone should be able to get a slice of pizza, I believe. That's what Helen Bevan says. And so we brainstormed and we came up with the idea that we should spread the 100-day challenge across the east of England. And of course we went, of course we can do it, and let's get with an aim of getting 1,000 people up and dressed and moving across the east of England. We launched another 100-day challenge, got all the coups and teams across the east of England engaged. ESIST helped us with collecting the activity, and that was an absolute nightmare. And I'm sure Lisa will talk about how difficult it is to collect data. And so when Brian then moved on to drive the 70-day endPJparalysis, it made sense to try capture the data in a much more fluid, easy way, rather than on pieces of paper. Why not use an app? And that's where Oriane and her team came in to support and developed an app which went out free across the NHS for everyone to use, and it remains free as well. Can you still hear me? It just went a bit dark there. So now we have the app. Listened to all your comments, all the feedback, have had reviewed, I think, by Cambridge judge students as well, to make it the best that it can be. And that's why this launch is very, very exciting, because it has had feedback from those who work on the wards and what will work for them. So I'm delighted now to hand you over to Lisa so she can talk about her 100-day challenge. And over to you, Lisa.
Thanks, Kira. Just wait for the PowerPoint to come up. Thank you very much. Hello, everybody. As you know, my name's Lisa. I'm a clinical manager. When I was in my previous role, I was a project manager, and there's a lovely photo of me sat there, not the most flattering of photos. That was me in the role currently. If you can move to the next slide, please. I essentially, as Kira has alluded to, was also doing some work with Red to Green in our trust, and also with ESIST. And what we did was we very much looked at what would be a compelling story, what would be a compelling vision, to enable people to think about how we can get patients up, dressed and moving. So just wait for the next slide to move across. The technology's been particularly challenging, I think.
Apologies, it's not moving. Oh,
okay.
There we go. There we go.
Thank you. So yes, our little journey demonstrated a movement within the NHS that basically started in the local hospital across 3 sites. And as I said, it was really looking for a compelling story or a vision that we were able to think of. And we're just going to play a little YouTube, which basically was what inspired us to think how we could move forward with this day challenge. So
okay,
Alice,
yep, just bear with me. I'm just going to grab that.
Yeah, it's the last 100 days video, and that was our sort of our compelling vision almost, to see what we could do within our trust. And it was also to look at problems and how we could reduce pressure ulcers and the rates in terms of that. So moving on to the next slide, please.
I'm trying. I'm so sorry. It won't move. There we go. There we go.
So after we had our vision and our thoughts, what we did was we planned. So we looked at planning for meaningful dates, particular dates. So plans ahead. We planned across 3 sites, because at the time we were also merging 3 sites within the trust. So we planned that into the mix. We had a vision, we had our dates, we had where we were doing it, and moving forward with that, we looked at how we could instigate, sorry, we're just catching up, thank you. Love technology. How we could instigate ways of driving up engagement for the staff, because equally it was around how we could engage with them. So we had developed some plaques and pledges. We produced an atrium stand. These are some of the examples of the pledges that we used. We used them for both staff and patients. While we were looking through, we also used the power of social media. As a corporate team at the time, we did some fundraising in the background, with the view to whoever was the ward that had the most patients up, dressed and moving. By the end of the 100 days challenge, they were given funds back to them to use for patient equipment. We also collaborated with others, as Kira's obviously alluded to earlier. So we reached out to colleagues, not just within the trust, but also outside of the trust. And we developed a manual board at the time. And remember, this was kind of the precursor of what Kira was talking about, a league board, which was an AO chart that was printed, and it literally had 1 to 100 on it. And the ward also provided with manual tally charts. And they essentially, as they got each patient up, dressed and moving, they literally just charted the patients from a daily point of view. We as a corporate team then came round each ward, and we rotated around the different sites, and we would collect that information, and then that was all fed back and it was produced onto a league board. The league board itself also had the bronze, silver and gold, they were crowns at that point, that we used. So it's almost that power of using visible icons. If you move to the next slide, please.
Trying. I don't know why PowerPoint's decided not to work. I'm so sorry.
It's stupid, isn't it? So what we did was essentially we made the initiative and we gamified it. It was gamification, and it was we spoke about it being a quality improvement initiative, because it was. And we incentivise staff. So we moved forward with some of the fundraising activities and stuff we were doing. Bake-offs, which is what you saw probably 2 years back on social media, etc. We did some healthy competitions between the ward staff, and they did that themselves. They kind of like, it snowballed a bit from their point of view. We engaged quite heavily with the patients and the carers, so we spoke to them in quite some depth as we got the pledges from them. But equally, we acted on some of the feedback that they would talk to us about. And we also developed weekly communications with staff. So our comms team would give out weekly communications of where people were, where the wards were, in terms of the league board, and obviously there's the league table they could see on the internet site as well. Try and go to the next slide if we can. I'll just carry on. So these were some of the results. So this is a total of 30 wards and areas took place at the time. And this was some of the Excel data collection that we got. So again, as Kira said, This is all done manually, it's all done Excel at this time. We had no app involvement. So this is very much the early adoption of everything. And within week 12 of the 100-day challenge, we had over 18,397 patients that got dressed and moving in one form or another. I think the thing to share from my point of view, following the 100-day challenge, was this is very much around collaborating and talking and sharing your vision with not just yourselves in a team, but go wider. You can see here some pictures of us, and this is the meeting that Kira was talking about when we met with Brian, myself, and a few others. We also were fortunate to have some involvement from a really good comms lead, Courtney, and he developed the leaflet you can see there. You don't take clothes off, the Lego type one. This was me first met Brian Dolan. I spoke about the local 100-day challenge that I did. Not the most flattering picture, Brian, if you can see that. And then the collaboration itself, as we were talking, engaging with people, again, it was snowballing further. We then obviously was delightfully introduced to Sonia Sparkles, as I call her.
Sonia Sparkles.
Yeah, and she developed some of her pictorials that you can see, and that's in the bottom left corner. And again, you know, some amazing visions that she was producing around this time, and equally also the logo that we had there at the time. So very much about collaborating and sharing your experiences, but equally also being able to talk about it. And I think then moving forward, we were obviously striving to get some data collection, and as we moved into the sort of the regional, because the local 100-day challenge was still going on, and then we spoke about the regional challenge that Kira spoke about a few minutes ago, and we had ESIS that was involved, and we tried to do data collection, moving it from the manual to sort of electronic, and this was almost like a safety thermometer that was produced, and we would input the data, the manual data, into this. And as Kira said, you can see here on the right hand side, over that period of time there's 9 trusts that were involved, and by the end of the regional 100 days challenge we recorded 91,000 patients that were successfully dressed and moving, and this was the data collection that we could see. I think some of the problems there was it was quite a data collection that was obviously, you still had to rely on manual, you had to feed it in by certain date points, so there's always a bit of a lag there, and equally I think, you know, again the app that we were using at that point was very much very wieldy in terms of that. Wouldn't you agree, Kira?
Yes.
Remember that quite a bit. So sometimes it didn't go the same way that you wanted it to go, but you know, had some fun with it.
Yeah.
And I think what's really, really important is when you do any 100-day challenge is feedback. Get lots of feedback as you go through doing part of the PDSA cycle, etc. But look at some of the staff that feedback, get their feedback, capture it, and equally the patient's feedback. So these were just some of the feedback that we received at the time on the little feedback pages that you saw earlier, in terms of their so just give you a minute or two just to quickly read through that one. But essentially speaking, there was never a dull moment. Some of the barriers we had at times for feedback was mainly around relatives and the clothes and what could they do with the clothes, because obviously getting people dressed, it was bringing in a volume of clothes and or washing them. So it's about liaison, about communicating quite heavily with your relatives and patients from that. So if you go to the next slide, it should be some feedback from patients. So a bit more one-liner.
And actually, Lisa,
sorry.
Okay, that's great. Sorry, Lisa, I was just going to say, Kings Lynn, we had an issue as well around clothes, and we got masses of boxes donated of new clothes for patients, so it's really good. Yeah,
sorry. Yeah, that's true. And I think that was something that we learned as we moved through, wasn't it? Yeah. And so that's some patient feedback that we were able to capture as well. And the next slide really is around lessons learned. So I think for our point, again, the early adoption of a manual side of things was that we were able to engage with 30 wards, and the areas just really took ownership of it, engaged really well, sharing information, really, as I said, through networking, be it either locally and or externally. Good communication is definitely absolutely key in terms of that. So use your resources, use your iConnect pages or whatever you have. I wrote a case study, which if you wish to have that, I can send that on further. But it was really good. We enjoyed every part of it. I think the challenges was, as I said, was really the late data collection and also being manual. It was a lot of work to input. And then obviously sharing the networking were our next steps that was when we were looking to go into the regional challenge, which obviously was captured there. So again, as Kira spoken briefly, there was 9 trusts that were involved in the regional challenge. We again needed early starts and more communication, and that was a challenge in itself. And equally about embedded in the processes, because again it moved from sort of the manual side to this more electronic side. So I think there's more education we could have given staff in the early setup stages. And then I think again writing reports and developing more comms packs as it moved forward into the national 100-day challenge was the next steps to be captured then. I think lastly, my last slide is really around ensuring that whatever the successes are, it's really about celebrating the successes. So for us, for the local 100-day challenge, we raised a few £100s for the ward, and that money was given back to patients to buy some equipment. About the communication side of things and really sharing your story through social media, etc., writing your case study, etc., and celebrating by telling your story, by events like this. And I've had the fortune to go around to other trusts and speak to them about it as well. So I think absolutely, everything's a success when it comes to our patients and our staff.
Excellent. Thank you so much, Lisa. That's great. So that was a really weird, gosh, you reminded me, it feels like 100 years ago, 100 days, 100 years ago since we did it. And it was, but it was so exciting to be part of it. And it really felt that the NHS was truly collaborating on making sure that people were getting up, dressed and moving. I think we're going to move to questions now. And I noticed there's a few there. So one of the questions is, and Natalia, you might need to pick this up, is I work in a care home. How long does it take to record data for 65 residents? Most are mobile.
Yeah, and I suppose it would be great to have a little bit more of a chat to get some more information about how you operate, because that really depends. And we're really open to feedback from care homes, because obviously the last time we had this app roll out, it was within hospitals, and the reason we made it available to care homes is because they wanted to take part, but we haven't yet got the feedback that we'd like to have to be able to provide everything that care homes need. So what I would say is it really depends on your processes. So the app is obviously really easy. You would have seen you can pop the numbers in there really quickly. And also the app is available on mobile, so you can have people going around on their mobile devices and making those counts. So it can be really quick. It just really depends. For example, if you've got like 10 staff who are counting, then it depends on how you report that back to the person that enters it. So what the app does is it takes only one total for the day, so that's just something to remember. So we'd be interested to hear a bit more, and as I say, we can talk about this more offline because we'd be keen to hear what you think. We'd like to hear more about how you operate and how we can best adapt the app to account for that.
Fantastic, thank you. There's a question around do we have posters that we can use, that people can use to raise awareness? I know on the NHS Improvement website there is a ton of resources, and of course myself and Lisa will have resources from before. What I found though, Lisa, you might think so as well, it's often best to adapt for your organisation. And what we're really lucky, if you find a poster that you think will work and you don't want to reinvent the wheel, most organisations were very happy for the logo to be put on. And that's where Courtney Baines, who designed the "You Don't Have to Take Your Clothes Off," who was working with me on the 100-day challenge at Addenbrooke's, he then very kindly populated future posters with the logo from other organisations. So there's lots of posters out there. Choose the one you like and ask. But of course, we will build a repository, I believe, Ariane, of posters.
So I can just add to that. We do have on the website, we've got logos, we've got email footers. We've got a poster that you can edit in PowerPoint so that you can add your own organisational logos as well. But we'd be quite keen to create something really 100-day challenge specific as well. So we'll be adding that in the coming weeks. So yeah, lots of stuff out there.
Great, thank you. Fantastic. Natalia, another one, or for all of us, I guess. In your experience, how do you use the data with existing reporting? Lisa, would you like to pick that up for your 100-day challenge? And I can comment on my side, or would you like me to answer?
No, that's fine. So I think some of the things that we did was we were able to weave it into various quality committees and quality reports, those sort of things. We were able to use the data for that, but equally we're also able to tie it up with being able to show a tangible difference with our pressure ulcers rates particularly. So we're actually able to link it to that during that time period.
So I think this is something that the app is now allowing you to do. Sorry. Now I was going to say the app allows
operationally.
Okay.
Sorry, Ariane, just wait. Operationally, how the data can link in to give you evidence that endPJparalysis works is that operationally you can link it in with your reduction in length of stay, and in particular stranded patients, for which we know that most of these patients who are frail and frail older patients tend to be in that category that NHS organisations have to report on. So your 7, 14 and 21 day length of stay. And you will see an impact on your A&E department as well. So you can link in all your evidence because you'll collect it on your app and link it to your data for reductions in length of stay operationally. Ariane, sorry.
No, sorry, there was a bit of lag on the line, so I think that's why we're cross-wired. I was just saying the app this time, following some great feedback we received last time, allows you to log pressure ulcers, occurrence, falls, and so it's very easy on the reporting function of the app this time to actually compare those almost instantaneously. And obviously you've got the ability to sort of download the data and look at it in a CSV to share with colleagues who might be enjoying some data crunching and comparing with A&E and lengths of stay, as you say, Kira.
Yeah, to add to that, that was something I forgot to mention as I was going through the app. If you are an admin, you can download all of the entries for your organisation in CSV so that you just have those nice juicy figures in an Excel to do with as you wish. How do you get your comms team on board, Lisa? I find them hard to engage.
Okay, so I think it's about relationship working. So I had a really good relationship with my comms.
Oh, sorry.
Okay. So and it was basically just getting on board simply by creating that relationship. So I worked with them very closely from day one. So from the concept of the vision right the way through. And I think it is just that close working, and I agree, sometimes it can be hard. And I guess for me, it might be different because I sat in a corporate position at that point. But equally, you know, I was at the door all the time in a nice way. And actually, they did joke at one point, said, did I want a job with them? So, you know, so it was a nice offer.
To add to that,
Yeah,
one of the things we thought about in incorporating that award element to the app was having that as nice leverage. So, you know, you can say, you know, we're going to work towards this nice award, and something that you can shout about. So I think that really helps.
Can you hear me now before I?
Yeah.
Can you hear me now? Okay. So one thing that I also did was I stalked Courtney to get me a poster, because he was really creative. So go to your most creative person in your comms team and help them. And I actually sang that song to him, "We Don't Have to Take Our Clothes Off," until he and then he used it. He was wondering should he use it, and then he used it in the posters, which was really good, because then it just went through the organization really well. So use your most creative people, or design the posters yourself.
Yeah.
I wrote, before I launched my 100-day challenge at Addenbrooke's, I wrote to the board, and I wrote my compelling reason and story for the board, and that way then I had the sign up from the board as to why, and we can help you with that. And mine was, you know, that my father always told me that time, you know, the most important thing you can give to people is time. And so this really links in with Brian's work around the last 1,000 days and endPJparalysis, and that's why I was able to write that passionate letter to them to get the go-ahead and the agreement for the 100-day challenge and the support from comms. So write your story. This is really about storytelling, and then at the end it's all about your data to prove it works. So I don't know if there's any more questions on I think we've done them all.
That's just it. There's just someone saying that they would love to see the CSE study. So.
Oh, Lisa's case study.
Yeah.
Yeah, I'm sure, Lisa, you can send that through to Natalia, and you can pop it on the website.
Yeah.
Absolutely. And I'll tweet it as well.
Lovely.
Fantastic. Great. So I think that if there's no more questions, I really want to thank Lisa for her fantastic story. And it's always great to catch up with you as well. And Natalia and Oriane as well for developing this app for the NHS. And it's still free for the NHS, and it's still free for people to continue driving mobility across their wards, and getting patients home to where they should be, and supporting care homes as well, which is really where we also want to support too. Okay, thank you very much. If you need any of the materials, they'll be on the website, and I believe this has been recorded.
Yep.
And so we will be able to share, you'll be able to access that as well on the website.
Mm-hmm.
Thank you very much for your time. And good night.
Thanks, everyone.
Thank you. Bye.
Bye.
Bye bye.
Thank you. Bye.